And welcome to Farm to Home with Thomas McDowell this morning. Rocky Mountain Medical Park Pharmacy in the Boyce Willis building. So glad to have you on this morning with some more information on, guess what? We've got to be informed, y'all. I keep telling you every week, you got to be informed about Medicare because we don't know everything we need to know. We need to ask the professionals. So that's what we're doing this morning.
Well, it's that time of year. I'm sure our Medicare folks are getting letters and calls, probably more, many more than you would like, and it's a very confusing time, and you have folks calling you trying to sell you plans and policies, and so we try to really provide education and information, especially in these segments. And so we talked about Medicare last segment, really focused on the overall changes to Medicare D, really focusing in on the prescription drug market. That's our bread and butter at Medical Park Pharmacy. And we talked about the max out-of-pocket being decreased to $2,000. So the most you'll have to pay for your prescription medications in 2025 is $2,000. Now, some people may pay significantly less than that if you're only on a handful of drugs and they're cheap generics. But if you're taking 1, 2, 3 brand medications, then you are probably going to see some decreases in your out-of-pocket expenses on your prescription side. Your insurance company determines the copay for those medications. The pharmacy adjudicates the claim and tells you what the insurance copay is. So, I'm hopeful that some patients will see some benefit from these changes. Yes. And so, decreased max out-of-pocket, no more donut hole, no more coverage gap. So we, again, just quick recap, we have 3 phases in Medicare D now. It used to be 4. So 3 phases. Deductible phase is the first one. Most standard Medicare D plans have a $590 deductible. That's the amount you pay out of pocket before your insurance, your Medicare D plan, kicks in to even help cover any of the cost of the drugs. And then the second phase is the initial coverage phase, and that's where you're paying some of the costs. Your insurance plan, your Medicare D plan is covering hopefully a higher percent cost than you're paying. But that, for a lot of the standard Medicare D plans, that percentage that you're going to pay is going to be 25%. And so while the max out-of-pocket is lower, you may see some higher copays at the first of the year than you're used to, versus in past years you would see a high deductible copay and then a significantly lower copay, and then you'd have a spike during the donut hole.
Right.
So what I'm foreseeing now is for a lot of patients high copays at the first of the year, and then if you hit that max out-of-pocket, your copays are 0 after that. And so kind of climbing the mountain initially, and then it's a lot better later in the year versus in the past. It was tough at the first of the year, better, and then another spike at the donut hole, and then eventually you may hit that catastrophic phase. So I know that's complicated, but ask us if you have questions. So this segment, I really wanted to hone in on one of what I think may be one of the most confusing aspects of the changes in Medicare D that people are going to get letters and questions about, is the Medicare prescription payment plan. So that is some legislation that has been built in. All Medicare D plans and Medicare Advantage plans with drug coverage are required to participate in this plan. And what it is something that is voluntary and optional, that you as a beneficiary with a Medicare D plan can enroll in. And so the purpose of it is it smooths your copay cost throughout the 12 months versus having high deductible copays. So say that you go into the pharmacy in January and you have a brand medication and it is coming back at $500 is what you owe.
Right.
Because you have a $590 deductible. And that's your amount that you owe, and you're meeting your deductible. Some folks on a fixed income may not have $500 at one time. And so those patients can enroll in this Medicare prescription payment plan, and the total cost of their drugs for that month, if they enrolled, would be basically divided by 12 and smoothed out across the 12 months.
Right.
And so it doesn't save you money. You're still going to pay the same cost, but it spreads it out. So this payment plan is something that you have to sign up for. And so what will happen is if you enroll, I'm being told it's a fairly quick turnaround. You have to enroll through the plan, through your Medicare D plan, so you have to contact them, and I foresee some potential issues there with the customer service on some of these
Yes.
plans. They're big companies. It's hard to
Sure.
get to somebody. But they're saying, we're hearing it should be a quick turnaround. If you enrolled, what would happen is that copay at the pharmacy would go down to zero. And
Yes.
then you would get a bill from your Medicare D plan monthly with that smoothing cost. And so that's, for us in the pharmacy, we don't have to handle the money,
Right.
So that part could be appealing to pharmacies, less cash to have to handle. And so we would get paid, the amount, we would get paid at the pharmacy the amount that you owe plus what your insurance plan would pay us.
Right.
And then the insurance plan is the one that has to deal with collecting
Yes.
your copay amount. So they are going to have to track that down. If you don't pay for 2 months, say you get bills you enroll and you get bills for 2 months. If you don't pay, you will be unenrolled automatically from the payment plan. You cannot be terminated from your insurance plan if you
Okay.
don't pay this bill.
Okay.
Now, if you don't pay your premium, you can get terminated.
Sure.
So this is really no risk on this plan for the consumer. All the risk is carried by the Medicare D plan, because I don't know what they'll do if they're having trouble tracking down the copay amount from the patient, but they'll unenroll them from the payment plan, but not the Medicare D plan itself.
Right.
So that's it's going to be a lot of questions around that.
Yes.
And so you may have your pharmacy actually let you know about this. So you might have your pharmacist come and tell you you're a good candidate for this program. And it's really, I only foresee it helping patients with expensive brain medications that have high cost at the first of the year. Because what's going to happen is if you're on cheap generics, you're not paying much to begin with, probably.
Right.
And so smoothing that out actually sometimes ends up increasing your copays at the end of the year. So
Right.
you're just kind of reversing it. You're not paying more, you're just paying less at the first of the year, more at the end of the year. So the main patients that this will help is if you go to the pharmacy counter and you can't afford that deductible copay,
Right.
this might be an option for you.
Absolutely.
Especially if you're going to feel like you have to not get that critical medication that you need. And keep in mind, if you're on insulin is capped at $35 in Medicare per 30-day supply.
And I know that is good news to a lot of people out there that have diabetes. I know
So,
that is good news.
No deductible required on
Yes.
those. So you're not going to come in and get if you're on Medicare, you should not be coming into the pharmacy getting a $500 copay on your insulin. So that's good news.
That
So
is real good news.
it's going to be some of the other tablet form like diabetes medications, Jardiance, Farxiga, Invokana, the Ozempics and the Trulicities. Those are expensive
Right.
medications. If you're on some of those drugs and you have a really high copay at the first of the year, you may want to consider looking at this prescription payment plan. If you have questions, we can help you. Just keep in mind, there's some Medicare D plans that don't have deductibles. And so those plans kind of inherently smooth the cost better throughout the year just because you're not going to have a huge deductible copay.
Right.
So what I want to reiterate is really important year to look at your Medicare D plan. We're reaching out and letting our folks know we're here to help at the pharmacy. We understand the drugs and the Medicare D plans, in my biased opinion, better than almost anyone else because we see it and live it every day.
Right.
And so if you have questions about your Medicare D plan or your prescription drug cost, reach out to us. We're doing Medicare reviews at the pharmacy throughout Medicare open enrollment. If you
Should
didn't,
they make an appointment if they want to
Yeah.
take some time? Should they make an
yeah,
appointment?
absolutely. And so,
And there's a number.
yep, you can call our number and we can help you set up an appointment. We have an appointment scheduling system where you can call and we can set you up with an appointment, or you can go to our website at RockyMountMedParkRx.com. That's RockyMountMedParkRx.com, and right there on the header, on the home screen, you'll see schedule a Medicare D consultation. And if you just Google Rocky Mountain Medical Park Pharmacy, you can find our website too. And book a time with me. You'll probably be speaking with me, and we'll try to help you make sure that you're in a plan that meets your needs, that's affordable. But drastic changes in Medicare D, the plan that you're in now might not be the best plan in 2025.
Right.
So I highly encourage you to, if you're working with somebody already and have a local agent, talk to them. And if you want to talk to us, we're happy to help as well. But you could save, you might save a lot of money by looking at it.
Well, I want to go back to something you said earlier about getting a lot of phone calls from, wanting you to buy from their company, Medicare plans from their company. Why would you do that? Folks, these people do not have your best interest at heart. They don't know you from Adam. It is so much better. I mean, is that what you would basically say?
And I certainly don't, I don't know all those folks, but I do see a lot of our, patients getting calls from folks that are really pushing them to sell.
My mother is inundated with these phone calls, and it's so aggravating.
And they are looking to typically
right now,
sell a policy.
Absolutely.
And so we're looking
Go
to
to
be
your local person. We know where you are. We can find you.
Yeah, and we're here to help for the long haul, not to just kind of sell
Yes.
something and be gone, for the rest of the year. So we're here to answer questions. I have folks that we help, they'll contact us throughout the year with, hey, what's going on with this copay, and we can explain it to them. So work with somebody you trust, because there are a lot of folks out there that are looking to sell something, and maybe you're not getting the full picture. Maybe they're just representing, one or two plans or just one company, and there's other things out there. So really important year to shop your Medicare D plan.
Yes, absolutely.
And this is the time to do it. October 15th through December 7th is the open enrollment period, where typically that's one of the only times for most patients that you can sign up for a different plan, switch plans, and your new plan will start January 1st, 2025. There's some special enrollment periods, or if you're new to Medicare, turning 65, you have a special window. If you have Medicare and Medicaid, you have some other windows. But for a typical consumer with no Medicaid, no special enrollment period, this is your time to look. If you wait until summertime next year, you're not going to be able to change your plan. And so you're stuck in it till the next year.
That's right.
So important time to look, and don't put it off. It really is pain-free. We plug your drugs in, and we can see what your cost will be. And the nice thing about having a pharmacist look at it is, if there's maybe a big cost spike in one of your drugs, we might have an alternative that we can consider, or a generic medication. We can even reach out to your doctor and talk about it. And so there's a lot of options out there. And typically through our pharmacy Medicare reviews, we've saved folks sometimes over $1,000.
Well, think of your pharmacist as your dentist, your doctor. I mean, you go to the same dentist, you go to the same doctor, because they know your history, and it's so much easier. Well, stick to a pharmacist. Find a pharmacist, and Thomas is very knowledgeable. Find your pharmacist and stick with them, because then they'll have all your records. They'll know if there's drug interactions, if this interacts, because once in a while a doctor will just kind of miss it. Maybe he didn't look back far enough on the chart to see if you take this medication and it'll interact. There's so many, and then the information that they offer, such as this Medicare information. You need to stick with your pharmacist like you do your doctor.
Yeah, I mean, we're very accessible. That's kind of the beauty of your local pharmacy, is we're accessible. If you're not feeling that that's the case at your pharmacy now, or if you're going to a big box store and you feel like, you may just be a number and you're getting shuffled through and no time for questions or long wait times, it doesn't have to be that way. And I would tell you too, if your insurance company is sending you letters or calling you and telling you need to go to a different pharmacy, and you're using a local pharmacy and they're trying to tell you need to go elsewhere,
Right.
I would encourage you to talk to your pharmacist. That's typically not the case. A lot of these companies are vertically integrated. The insurance company owns the pharmacy benefit manager, or vice versa, who also owns their own pharmacy or mail order pharmacy. That they definitely want you to steer you to that because
Yes.
it benefits them.
That's
and not
right.
necessarily you. So you still have a choice in where you go and where you get your Medicare prescriptions. And so, I would encourage you to always just talk to your pharmacist. If you're getting letters or things that you're not understanding or unsure about, come and talk to us. And even if you're not our patient and you need some help, we'll try to help you. We're always accepting new patients, and we're always looking to help more people and grow. And so we have a wonderful staff. I do want to give a quick shout out. I know we're about out of time, to our pharmacists and our pharmacy technicians. October is American Pharmacist Month.
Oh, really?
And so
Okay.
we have a wonderful staff of pharmacists. Devin's our pharmacy manager at Medical Park Pharmacy. And we have Nikki, Martha, and my father, Joe McDowell, and myself, kind of at McDowell's. I'm at both locations, so shout out to our team there. Yesterday was National Pharmacy Technician Day.
Oh, wow.
So shout out to our pharmacy technicians. They're really
Absolutely.
the backbone of the pharmacy. They're doing so many things behind the scenes, talking to insurance companies, calling other pharmacies for transfers, managing inventory, trying to make sure that you're on a safe medication, and working with our pharmacists, to coordinate care with your providers and just to keep you healthy and safe. So, tell your local pharmacists that you appreciate them if you have somebody you're working with. And so I just want to give a shout out to our team. We appreciate everything that they do. And so
Absolutely. Well, Thomas, thank you again for coming and enlightening us this morning on such a complicated issue. So if you do have questions, 443-7979, make your appointment with one of the staff. But as Thomas said, it will probably be him you're talking to, but at Medical Park Pharmacy, located in the Boyce Willis building on Winston Avenue. So thank you, Thomas.
thanks, Sandra. Appreciate you.
We look forward to next time. We'll be right back right after this.